Hi, my name is Luz Biminda. I am your nurse today. I have already checked your chart for past medical history like your medical illness, medications such as prescribed, over-the-counter, herbal, and street drugs, any allergies, smoking, and alcohol consumption. Before I start, may I have your name?
Nolly.
I will sanitize my hands first, gather my sanitized equipment, prepare the room, and I will provide privacy and confidentiality. I understand you are coming with a concern with your tummy, so I will be doing an assessment in your abdomen. That involves inspection, auscultation, using my stethoscope, and percussion and palpation using my hands. Can I have your consent?
Yes.
Okay, can you tell me more about your nausea and vomiting? How often did you vomit?
Once.
What is the color?
It's brown.
Was there any blood?
No.
No. Okay, so we're going now to do the inspection. So if you need to empty your bladder, you can do it now.
Okay.
This is the appropriate position for abdominal assessment. Hands on the side, supine or lying position. Knees can be bent if he wants to, but he wants it like this. So assuming I have done all the vital signs, if there's change on the health status, I'll check for the urine output, level of consciousness and orientation, capillary refill, arterial blood gases as appropriate, and if resources permit. I am going to ask if you have any localized pain,
No.
because if the patient has localized pain, then I will be doing that as the last part. Now I'm going to proceed to the inspection of the abdomen. So I'm checking for the contour, and I'm standing on this right side and gazing it so I can see if the abdomen is flat or rounded. His abdomen is flat. There's no, it's not scapoid and it's not protuberant. I'm going to shine a light on your abdomen to check for the symmetry. So I'm checking for any bulges, for any masses and hernia. There is no bulges, there's no masses, there's no hernia, and abdomen is symmetrical bilaterally. Now, I am inspecting the umbilicus, and the umbilicus is in midline and inverted. There's no sign of any discoloration and hernia or inflammation. The skin surface is smooth and even with homogeneous color according to his racial. There's no jaundice, there's no stray. I am checking also for the pulsation or movement in the epigastric area. So there is no pulsation, there is no waves of peristalsis. So in thin patients, you can visible pulsation and visible waves of peristalsis. Now for the hair distribution, because he is a man, it is diamond in shape, and for women, it is inverted triangle. The demeanor of the patient, he is relaxed, quiet, comfortable, and slow respiration. And now I'm going to auscultate for bowel sounds. I'm going to warm the stethoscope and my hands to avoid abdominal tensing. I'm using the diaphragm of my stethoscope to listen in all four quadrants, beginning in the right lower quadrant at the ileocecal valve area. Bowel sounds are normally present here. And then going to the right upper quadrant, to the left upper quadrant, and going to the left lower quadrant. Bowel sounds are present. It's a high-pitched gargling cascading sound, anywhere from 5 to 30 times per minute. We're judging for any bowel sounds here if it's normal, hypoactive, or hyperactive. So now, I'm going to listen to the vascular sound. I am going to use the bell of my stethoscope and listening in the aorta in the epigastric area and renal artery, listening for bruit to the iliac artery below the abdomen, and checking it bilaterally, and also going to the femoral artery, like on the groin, on this part, and checking it bilaterally. So normally, there should be no bruit sound heard. Now I'm going to percuss for general tympani for the four quadrants in the tummy, and I am using my hands and warming it. So percussing to the right lower quadrant, listening for tympani versus dullness. Doing all the 4 quadrants. Tympani is present. Tympani should predominate because air in the intestine rises to surface of patient when he is in supine position. I'm percussing the liver span, starting on the mid-clavicular line, going down. I'm percussing until the sound changes to dull quality. I will mark the spot, and usually it's on the 5th intercostal spaces. Then, going down, I will percuss up. And then map it up, mark 8 centimeter. So the measurement for normal liver span is 6 to 12 centimeter. For men, normal is 10.5 centimeter. For women, it's 7 centimeter. He has 8 centimeter. So now I'm going to percuss the splenic dullness, percussing on the 9 to 11 intercostal space, on the left mid-axillary line. So this part, 1, 9. Percussing. So the area of splenic dullness normally not wider than 7 centimeter, and I heard tympani on this side. I want you to please sit up. So I am now percussing for the kidney. I'm percussing for the kidney now. I'm placing my hand at the 12 rib at costovertebral angle on his back. Can you feel the thud?
Yes.
Can you feel any pain?
No.
Can you feel the thud?
Yes.
Can you feel any pain?
No.
Thank you. So checking it bilaterally, and it was okay. I will do light palpation now. 1 centimeter depression. I will warm my hands, and I will do all in the 4 quadrants. I will start on the right lower quadrants, going up to the upper quadrant, left upper quadrant to the left lower quadrant. So my objective here is not to search for organs, but to form an overall impression of skin surface and superficial musculature. So there's no involuntary rigidity in my palpation. I'm done with all the assessment, inspection. Abdomen is flat, symmetrical, there's no apparent masses. Skin is smooth with no stray, no scars, no lesions. Auscultation, bowel sounds are present, there's no bruit. And percussion, tympani predominates in all 4 quadrants, and the liver span is 8 centimeter. Splenic dullness is located on the 10th ICS in left mid-axillary line. In my palpation, abdomen is soft, there is no masses, there is no tenderness. You have a healthy abdomen and bowel sounds are present. We are done with the assessment, so I'm going to bring this information to the healthcare provider for a consult. Then I will get back to you to what next plan of care we need to do. Thank you very much.